The 40-yard dash. The 40-yard dash is a test for speed. You want to see how fast your athlete can get from point A to point B. This test is ideally for those who participate in a sport with an extended run, such as football, baseball, basketball, soccer, lacrosse, or hockey. The only risk with this test is fatigue. Your athlete may become tired after each trial. To keep your athlete from being tired, have your athlete rest at least 3 to 5 minutes in between each trial. Also, you want an accurate time. To have an accurate time, have a timer at the starting line and a timer at the finish line. The timer at the starting line should drop his or her hand as soon as the athlete makes first contact with the ground from their 3-hand or 4-hand stance. The timer at the finish line should then start the clock as soon as he or she sees the drop of the hand. The timer should then stop the clock as soon as the athlete runs past the finish line. Your athlete may start from a 3-hand stance or a 4-hand stance. The 5-10-5 agility test. This is a test for agility. You want to see how fast your athlete can get from point A to point B while changing direction as quick as possible. This is a test for those who participate in a sport that requires short sprints and change of direction, such as basketball, football, soccer, volleyball, or baseball. The only risk with this test is fatigue. Your athlete may become tired after each trial. To keep your athlete from becoming tired, have your athlete rest at least 3 to 5 minutes in between each trial. Also, the timer should start the clock as soon as the athlete makes his or her first move. The 3-cone test. This is a test for agility. Just like any other test for agility, you want to see how fast your athlete can get from cone to cone as quickly as possible while changing direction without losing much time. This is a test ideally for those who participate in a sport that requires short sprints and a change of direction, such as football, baseball, volleyball, soccer, or basketball. The only risk with this test is fatigue. To keep your athlete from being tired, have your athlete rest at least 3 to 5 minutes in between each trial. Also, the timer should be standing at the first cone. This test starts and finishes at the first cone. The time should start as soon as the athlete makes his or her first move. The cones should be within 5 yards apart. Med ball put. This is a test for power. The significance of this test is to see how strong your athlete's upper body is. This test is ideally for those who participate in a sport that requires a chest pass, such as basketball. The only risk of this test is fatigue. To keep your athlete from becoming tired, have your athlete rest at least 2 minutes in between each trial. The athlete is only allowed 3 to 5 attempts. Vertical jump test. This is a test of power and explosiveness. You want to see how much power there is in the lower body of your athlete. This test is mainly for those who participate in sports that requires jumping, such as volleyball, basketball, baseball, or softball. Alright, standing long jump. What you want to do is stand behind the line, and when you get here, you want to bend down and power up and out. Your goal is to power up and then go out. So it will be like a jump. You're jumping up high, but you're also wanting to land out as far as you can. And that is the standing long jump. Standing long jump test. This is a test of power and explosiveness. This test is significant because it shows the athlete's vertical and horizontal jumping abilities. This test is mainly for those who participate in sports that requires jumping, such as volleyball, basketball, softball, or baseball. Push-up test. Push-up test. You do a regular push-up. When you get down and go up, Make sure your body is parallel to the ground. So down, up. Push-up test. This is a test of upper body strength. The athlete is required to do as many push-ups as possible. This will then show how strong the athlete's upper body is. This test is ideally for those who have to use upper body throughout their sport, such as volleyball, football, basketball, or baseball. Overhead squat. The purpose of this test is to observe the moving patterns of an athlete. Throughout this test, you will be able to see the athlete's mobility and core stability while the hips and shoulders are moving in symmetrical positions. This test is ideally for all athletes. This test will show you if the athlete needs to strengthen their glutes or hamstrings. The only risk to this test is failure. If an athlete receives a low score, he or she may feel as if they aren't ready for any competition, which may lead to doubt, and doubt may lead to injuries. You are a girl, you put your hands by your chin and you just push your hands out in starting position. Keep your feet close together and you put your arms up like this and you just push up. If you are a male, put your hands out in front of your head like this. And the same with your legs. Keep them straight, keep them together and you just push up. Trunk stability test. The purpose of this test is to see if your athlete has core stabilization. This test is ideally for all athletes because all athletes must have a strong core in order for a strong performance. Active straight leg raise. This test is to measure the athlete's hip mobility. This test is ideally for all athletes because all athletes must have quality hip mobility in order to be successful in their sport. Resting heart rate. The first step of taking someone's resting heart rate is to place 2 fingers on the thumb side of the wrist. The 2 fingers you should use is the index finger and the middle finger. Do not use your thumb because the thumb is known to have a pulse as well. Once your 2 fingers are placed on the thumb side of the wrist, firmly press until you feel a pulse. Count each pulse for a minute. Blood pressure. The first step of taking someone's blood pressure is to put the Velcro cuff on your bicep muscle. Make sure the cuff is not too loose or too tight. Secondly, place the stethoscope on the brachial artery. Firmly press the stethoscope into the brachial artery. Thirdly, pump the rubber bulb until the arrow meets 200 millimeters. Once the arrow meets 200 millimeters, slowly rotate the pressure valve counterclockwise. The first set of sounds you will hear will be the systolic blood pressure. Continue to rotate the pressure valve counterclockwise. The second set of sounds you will hear will be the diastolic blood pressure. Aerobic endurance test. The mile run is an aerobic endurance test. The mile run is used to measure the endurance of your athlete. This test is ideally for any athletes who participate in a sport that requires a lot of running, such as soccer, basketball, or track. The only risk of the mile run is shortness of breath or chest pain. If your athlete seems as if they are having trouble breathing, or if they seem that they are having chest pain, make them stop immediately.